And now on the line is Breda Gahan from Concern. Breda, welcome to the programme.
Thank you, Darren, and I can't believe we're coming up to World AIDS Day 2020, marking actually 40 years of the global HIV and AIDS epidemic coming up in 2021.
Okay, Breda, our last interview about HIV/AIDS was last December about World AIDS Day 2019. World AIDS Day is being celebrated again this month on the 1st of December, like every year since 1988. Can you tell me what changes and difference there is this World AIDS Day compared to last World AIDS Day, and with the fight in general to try to end AIDS, with the simultaneous fight we have to try to end COVID-19?
Well, absolutely. COVID-19 has changed everything for everybody and every infectious disease. And as resources are being used and economic activity is being curtailed, it is particularly a threat to funding going forward in terms of the global HIV and AIDS response. The good news is, however, that many lessons can be learned from the global HIV epidemic in terms of prevention. With HIV, there's a lot of talk currently on releasing the COVID vaccine, but 40 years later, there's still no vaccine against HIV. There is still no cure. Thankfully, a lot more people are on treatment, about 67% globally, as reported by UNAIDS currently, people who are living with HIV on treatment. But that still means almost a third, 33%, are not accessing treatment, which is very unjust. And most of these people are the poorest and the extreme poor living in urban slum or remote rural locations in areas where often Concern is working. And even still, there are about 4,500 new HIV infections reported globally every day. It's not on every news headline like COVID. It's not on every Irish news headline like COVID. And even still in Ireland, at least one new HIV infection is reported every day. But because there are less opportunities for testing, with curtailment of services, disruption of services, both in Ireland and globally, we are very concerned that a significant number of unreported, untested, undiagnosed infections are going ahead untreated, which means people untreated can spread HIV to other people. And this is a difficult and bad situation coming to the end of 2020 as we start 2021 marking 40 years of AIDS, which started in 1981.
67% of people around the world are on treatment. For some reason, I thought it was around 50%, so that's better than I thought it was.
It has improved. The latest data is that more people are accessing treatment, but we don't know how much the disruption of services might have actually lowered people accessing their treatment in the last 10 months. I mean, that data is just being collected now, so there is a concern that, because the data is always a year behind the actual reality, so that's 2019 data, so we don't know if that number will unfortunately have dropped this year, because some people are afraid to go to the health centres in case they contract COVID-19, a bit like Ebola in DRC previously, and in Liberia and in Sierra Leone. And also some of the health facilities aren't working because the health workers aren't going to work because they've been told to stay at home, or they're staying at home because they don't want to bring COVID home to their families. It's having a huge impact in terms of people uptaking essential HIV and other services, regular vaccination for children under 5, and having a big impact on delivery of services on the other side. And Irish Aid and Concern, other donors and partners are working now to try and support uptake of services in terms of people who've been afraid to go for them, and also support the better delivery of the services in a time of COVID-19. Because unfortunately, the COVID-19 pandemic hasn't ended anywhere, and especially not in the countries where Concern is working in Africa, Asia, and in Haiti.
So the figures for this year that will be released next year, there's probably going to be a big disruption with the figures,
There
isn't it?
could be a drop. There could be a drop. That's the concern. And more people living with HIV, not tested, not diagnosed, not on treatment, means more opportunity for the virus to pass to other people, and especially the most vulnerable and poor people. And again, we're in the 16 days of activism now, or action on violence against women. Females, especially women and girls, remain the most affected population, and AIDS regrettably remains the leading cause of death of women of childbearing age globally. This is again UNAIDS data this year, and every week, 5,500 young women aged 15 to 24 become infected with HIV. That's 800 almost every day. 800 every day. Again, it's not on our news bulletins. In Ireland, in the countries overseas, we have a lot to do to support protection and prevention of HIV from being transmitted to young women and girls. And definitely, we need to engage with young men and boys to support prevention of transmission. Sub-Saharan Africa, where concern is highly active, as you know, with Irish Aid and other global donors. It's the most affected region in terms of HIV. And still, last year, 7 out of 10 young women did not understand well how HIV is transmitted and how it's not transmitted. So through our education programs, we're trying to support that girls stay in school, receive a quality education, understand prevention, know how to prevent and reduce their risk, and engage young men and boys to support prevention among women and girls. There was a report released earlier this year by UNAIDS, We've Got the Power, Women, Adolescent Girls and the HIV Response, trying to work better with young women, girls, their guardians, parents, young men and boys in the community, religious leaders, political leaders, because to protect girls, as they say, it takes a village to raise a child. Well, it takes a village and a whole community and town and city from local to global level to protect women and girls from HIV. And the theme this year is all about solidarity, global solidarity and shared responsibility. And we're hearing a lot, even on our own radio here in Ireland this week, about, in terms of COVID, again, it's about responsibility to reduce our risk, to reduce our contacts, to support prevention so that the health system in this country is not overburdened coming up to Christmas and the New Year. And likewise in countries where concern is working. Prevention is best. We need to support and interrupt transmission of infection locally and globally.
Okay, Breda, what are your colleagues in the developing countries where you work telling you since March about the HIV services you have and the outreach you're doing in the countries in which you work?
Well, yes, in countries like Bangladesh, Burundi, Ethiopia, Liberia, Sudan, where I'm familiar with and working with our teams almost on a daily basis, they're saying that less people are going for testing, and this is a concern, as well as less people, women and children, are going for routine, essential maternal, mother and child health services. So their worry is that after COVID-19 hopefully has passed by the middle of 2021, especially if the vaccine is rolled out equitably in countries in Europe and the USA and in least developed countries where the most vulnerable can be protected, our worry is that we will see a surge once we have the data coming in for this year. So we are integrating the HIV response activities in all our sector programs, education, health and livelihoods. And just this week I received the plan from Bangladesh, where they're integrating HIV prevention and ending violence against women in all their work now for the 16 days of action between November the 25th and December the 11th, Human Rights Day. Other countries are doing similarly. They're integrating their World AIDS Day and responding to reduce violence against women around AIDS Day, before and after, and linking it with the national responses in country. Like I said, the global theme this year is global solidarity and shared responsibility. Some of the countries where concern is working take the global theme and adapt it to their own situation. So some would focus on education, some would focus on girls. In Burundi this year, Concern Burundi have integrated responses into their livelihood integrated program, and working with Burundian youth. And over 500 young people have received training and coaching on cross-cutting issues, including HIV and AIDS, conflict, and responding to and preventing gender-based violence, alongside reproductive health, family health, and nutrition education. Likewise, in Ethiopia, in our program supported by Irish Aid, Leaving No Girl Behind, HIV and AIDS is included during project implementation with all concerned staff and partners, sensitizing and educating communities on HIV prevention during all the different events, including coming up now World AIDS Day this year. In Liberia, it's with mothers groups, including it in the curriculum, how HIV is transmitted, how it's not transmitted, how we can protect ourselves, debunking the myths and misinformation surrounding HIV and AIDS, which likewise is a problem currently with COVID-19. There's a lot of fake news, a lot of misinformation. So it's been a challenge with concern, with Irish Aid, with UNAIDS, with the World Health Organization, our own government included, to support people to understand the facts and to source their information from trusted information sites so that people follow the correct information and implement the practices that can reduce transmission. In Sudan, concerned teams with our partners, their Community Development Association, are integrating it into the life-saving services and water and sanitation programs, including prevention. One of our partner organizations there is called Global Aid Hand, and they have been very successful, obviously speaking Arabic, the language in Sudan, to be able to reach communities that are hard to reach in areas still affected by internal conflict. And I think you know, Darren, about the current situation in Ethiopia, in Tigray. Many new refugees have crossed back into Sudan, up in Gadaref and Kassala. So all the time we are supporting populations on the move, especially migrants, displaced populations, refugees, remain at heightened risk because their situations are so unstable. They're so busy trying to secure the food they need for their children. Often they haven't time to be thinking about a virus that might infect them now, that might kill them years later, you know, when they need to meet their immediate needs today.
Okay. As regards fundraising in general for concern, I presume you've taken a big hit this year, have you, with donations from, say, government organisations, but also from the public as well, have you?
Well, thankfully not yet. We've a very good donor support base, and until now we actually haven't been hit. People understand, despite our difficulties here in Ireland, you know, and some of the older population are thinking back when they were children to the Spanish flu, which lasted more than 2 years. They missed 2 Christmases in very difficult times without electricity, running water, hot showers. That despite our difficulties, you know, we are in a different place. And who would have imagined in 10 months progress on prevention, treatment of COVID-19, and now a vaccine is on the horizon. I think I saw this week that WHO are evaluating 47 potential vaccines to be rolled out. Meanwhile, 40 years into the HIV and AIDS epidemic, we're still waiting for a vaccine, likewise for malaria, which you've discussed with me before. You know, when everybody comes together, 49 candidate vaccines now in clinical evaluation by WHO for COVID-19. So when people come together, people unite, science, investment, a lot can be done. So thankfully, our donors, especially Irish Aid, the Irish public, have been fantastic in continuing to support and help to keep our programs ongoing in the world's poorest countries. Extreme poverty is not going away. The big shock, again, will probably come later next year when hopefully we've got through COVID-19. But the economic shocks can go on much longer. And many people in concerned countries where we're working are worried about, access to survival and food. Hunger is an issue. Markets are not functioning well yet due to disruption of the global economic markets and even local markets. So if people can't sell their produce, they don't have income to buy food to feed their children. So we're literally living through this terrible experiment in terms of what's happening. But, we know how to stop COVID-19 transmission in Ireland now and globally. We know how to stop HIV transmission. We need to invest in prevention commensurately. Sustainable Development Goal 3.3 target is, to end the epidemic of AIDS by 2030. We've, how many years left?
9, is it, I think?
9, yeah, exactly. Time passes very quickly. We need to invest. Prevention is always better than cure. And investment in health and HIV prevention I see as investment in reducing poverty, extreme poverty, and protecting livelihoods. We know in the past, in the worst days of AIDS in sub-Saharan Africa, so many children dropped out of school as their parents got sick and died before treatment was available. Livelihoods collapsed. So many street children. The numbers increased significantly in East and Central Africa and Southern Africa. And we're not in a good place yet. I mean, Malawi remains the country with the highest prevalence where concern is working. Almost 1 in 10 adults, 1.1 million people, are currently living with HIV in Malawi. It's a poor country. Thankfully, it's not in conflict, but that is a huge burden on their economic development, education outcomes for the children, best livelihoods, because 1.1 million people need to stay on treatment, not to pass the infection on to other people, to be able to keep their kids in school. So a lot still to do. And obviously countries in conflict, the risks and vulnerabilities can be even greater when, women can take risks, transactional sex, to be able to get enough money to feed their children. And it's always a concern in countries in conflict still, like parts of South Sudan, parts of Ethiopia again. Burundi is still turbulent. So anywhere where there's conflict, insecurity, the risks are increased. And it's particularly bad for women and girls. So thanks, particularly Darren, to you and Near FM and everybody for marking the day this year, because, as you know, the International Global AIDS Conference was virtually held in San Francisco and in 2 locations this year, in San Francisco and in Mexico. But it received almost hardly any coverage. It was in July due to the fact that the AIDS epidemic was ongoing.
Yeah, that's held every 2 years, isn't it?
Every 2 years.
Yeah,
But
like
we
I
don't
didn't
actually
actually
know
know
yet
about it. Yeah, go ahead. Yeah.
exactly. It received almost no news, no media coverage in the Irish news media or globally. I had
God,
to search for it.
God.
And we're hoping to hold a feedback session next year. You know, I've been
Okay.
documenting the research findings. But
Okay.
yeah, that's the sad reality that it got so little attention because nobody could travel. It
Uh,
was virtual conference, so again, the extreme poor and people without IT access, internet access, again, generally the poorest, weren't able to see it online. They can't join the Zoom calls or join through the webinars or the podcasts. The most disadvantaged in terms of IT access still remain the extreme poor in the countries where concern is working, especially the urban, slum, poor populations and the extreme poor in rural areas. I mean, even people in rural Ireland are still complaining about lack of coverage, here due to COVID, trying to get their businesses running virtually when they weren't able to be open for the last number of weeks.
I presume, well, first of all, you took part in the conference online on Zoom, did you?
I joined some of the sessions on Zoom, yes, and because again, it was a very busy time in concern, working to protect our staff, our national staff, the populations we work with from contracting COVID-19. The best investment is in health, keeping the population healthy. So some of it I followed after hours and at the weekend, but most of it is uploaded online, and there's free access for people now who have internet access. So you can go online, Darren.
Okay.
Just Google AIDS 2020 San Francisco, and the community side of the conference was AIDS 2020 Mexico.
Okay, I won't keep you much longer, Breda. Just first of all, were there any surprises, any kind of surprises in the conference, or was it all kind of geared towards the impact of COVID, or what?
A lot of it was linked to the impact of COVID. Yes, I did an update on the highlights for myself, and we discussed them in concern. We'll probably have a webinar with Irish Aid and colleagues February or March next year to remind people that it did happen and what the main findings were. But it was looking at still the big treatment gap, in terms of 33% of the population globally still have no access to HIV treatment, and children are more disadvantaged than adults due to the lack of pediatric formulations. So anybody living with HIV who does not access treatment will still sadly die. There's still no cure, there's still no vaccine. And the main burden remains in sub-Saharan Africa, as I said, and young women, especially 10 to 24 years old. In terms of COVID, a lot was discussed at that time, especially because it was in the height of the worst days and nobody really knew would it get worse, how would it expand in Africa and Asia. But the impact it was having on disrupting routine services. At that stage it was almost a 6-month disruption in treatments and testing compared to what was normal. Okay. And they were extrapolating, what further disruption of treatment would cause. And they estimated even a 20% disruption could cause an additional 110,000 deaths. Right. There was a lot of discussion on PrEP, obviously, pre-exposure prophylaxis. U equals U. People who have been exposed or who are taking PrEP reduces their transmission from passing the virus to another person, and in fact they remain undetectable. So people taking pre-exposure prophylaxis as prescribed, but even in Ireland there was some disruption to PrEP services during the height of the epidemic. It's being re-established now. It's being re-established. So the Normally they announce the location for it'll be 2022, the next, is that right, 22, yeah. And normally they announce it every year because it's a big, event, because different countries tender to host the conference. But until now, they haven't announced it, I think, due to the lack of possibilities to travel and host conferences. So we actually don't know yet where the conference will be held in 2022. And hopefully then it will not be a virtual conference. And I would hope actually that it would be held in one of the lower income countries and on the African or Asian continent, especially Africa, where the epicenter of the HIV epidemic remains in sub-Saharan Africa. In a country like it's relatively peaceful, easy access, like Kenya, Nairobi, Ethiopia by then, I think that would be a good outcome. So we can focus where the priority problem is. Like San Francisco is very far from sub-Saharan Africa, and I think that did affect interest as well, and we won't go into the politics, but it didn't heighten interest, let's say, from countries in poorer parts of the world. But with the theme of this year, global solidarity and shared responsibility, with our important donors from Irish Aid to UK Aid to USAID, hopefully we can get back on track in early 2021 to prevent new infections. Like I've always said, HIV is technically 100% preventable. Re-establish treatment everywhere so that people know as soon as possible if they're infected, so they can protect themselves from passing it on to other people and save their own lives by accessing treatment that is increasingly available. But we need to advocate that the treatment is funded, especially for the poorest countries. The worry is that the economic situation in terms of the global impact of COVID-19 could interrupt investment in funding. And this would be a terrible outcome in terms of delivery, like I said, of SDG 3, ending the AIDS epidemic by 2030. But all the Sustainable Development Goals, which we're all working towards, all DOCUS members, all COLOF members, Irish Aid, all donors, could be threatened. 9 years is not a long time left to deliver on these Sustainable Development Goals. So I hope that by working together with the media, with the private sector, with our donors, with our community donors, we can get through this and end AIDS by 2030.
That has actually happened in the UK. It was announced in the last week or two, hasn't it? There's going to be $4 billion cut from the aid program for next year. So I presume, like as you said, there is a real fear that could happen frequently all over the world over the next few years because of the economic effects of COVID. Yeah.
Absolutely. I mean, with so many more people out of work, they don't have disposable income to share, and loss of jobs is a big factor everywhere. Lots of migrant workers went to their homes. They're not sending remittances back, like so many people in Bangladesh. So many poor families have people working in the Middle East. A lot of them are still not allowed back. So we're kind of waiting to see what would happen will happen in 2021. But the situation has been so volatile, even in the last 10 months, that maybe you can come back to me, Darren, in the summer, and we see where we are. And hopefully, with the rollout of the vaccine, I'm hoping the virus will be less virulent, and maybe we'll be all in a much better place. And the learning from COVID-19 and HIV, and thankfully the latest Ebola outbreak has ended in DRC. Concern has been working in the eastern Congo with our partners there. So that's good news. So good news is happening. The treatment for COVID-19 is much better now than it was in the early days in March, April, May, even in Ireland. So hopefully we can get the same enthusiasm for ending AIDS and certainly stopping HIV transmission locally and globally soonest.